Long-term use of antidepressants can cause brain damage. And are your physicians talking to you about this? Are anybody telling you about this? Let's check this out. This is important. Hi, Dr. Paul Haider, Master Herbalist and Health and Wellness Instructor for 34 years. Let's get the world healthy. If you like what I do, please give me a thumbs up, please subscribe, and please tell others they can watch here and get healthy. We got a lot of sick people. Get healthy. Well, today I want to talk about the fact that nobody's talking about the fact that there's a lot of problems with antidepressants causing brain damage and other things that are actually cause mortality, and which is death. So it's really not good. Let's go over quite a few of these things which kind of get pushed under the rug and nobody's talking about. Long-term use of antidepressants can actually cause diabetes, and nobody wants diabetes, that's for sure. Also can cause heart problems and heart attacks, and people have died of this. This is not good. Also, gastrointestinal bleeding. That could lead to a major problem. There's no doubt about that. Also, major weight gain, sexual dysfunction. You can't have an orgasm. Also, dry mouth. Also, sleep disturbances. You can't sleep at all. Also, vision problems. You start getting blurry vision and reduced vision in general. Also, you start getting osteoporosis and much more to cover. They also have reduced feelings of just joy of any kind, and also emotional numbness, also suicidal thoughts. Withdrawal symptoms can be very long and have really bad effects also. After a while, a person can start to feel, I don't know who this person is I see in the mirror. I don't feel like myself. And have psychological dependence on these drugs after a while. Other side effects are feeling agitated, have indigestion, just being sick all the time, diarrhea, constipation, loss of appetite, dizziness, not sleeping, headaches, and migraines also. Loss of libido. You just can't have and you don't even have any feelings about having sex at all, and no orgasm, and all kinds of different things, and ED, and sexual dysfunction for men, erectile dysfunction, not good. Also, a person can come down with serotonin syndrome and feel confused and agitated, have muscle twitching, sweating and shivering and diarrhea. That's really not good. If this gets bad enough, they can have a seizure. Not good. And irregular heartbeats, which could lead to a heart attack and unconsciousness. Wow. And long-term effects can cause hyponatremia, where you don't have enough sodium, and then all this, the cells start to pick up all kinds of fluid, and that can cause feelings of being sick and headaches and muscle pain and reduced appetite and confusion, listlessness, disorientation, agitation, psychosis, not good, seizures, and on and on and on. And suicidal thoughts, this is really not good. Heaven help us. Also, it can cause the antidepressant cognitive impairment. You just can't think right. Also, things memory dysfunction and cognitive deficits. It's just brain is not working correctly. And this is really, really, really not good. I'm going to read one study directly. Long-term antidepressant use over 5 and 10 years was associated with the onset of diabetes, high blood pressure, coronary artery disease, stroke, and other syndromes, which can cause death, which is not good. Another study in 2019 showed it's not only causing changes in your brain, it's changing everything in your body. And that's really not good. Another study showed that it could cause irreversible brain alterations. Wow. On BBC in 1996, a big company, a drug company that starts with a PF, I'm not going to say their name, it said we should not volunteer withdrawal symptoms, but we have an agreed list in case they insist. Wow. And then just in the UK alone, I have 5 million people on some kind of antidepressant, and this can actually connected to severe, long-lasting withdrawal effects. And sometimes those go on for months, even a year or longer. Not good. And I've had people come to me who were taking antidepressants for 10 to 15 years, and they had done damage to themselves. There's no doubt about it. Now, let's be honest, antidepressants are good in the short run. If you have depression, you've had some terrible thing happen, maybe you had a death or, something else happen or lost a job and you need a little help in the meantime, a short-term thing can be amazing for people. But it does not take care of changing a person's life and start to get them going. And also, nothing like talk therapy, which will work things out so a person can get better and not have to take these drugs forever. Plus, there's natural things like saffron, L-ergotheanine, and all kinds of things that can perk a person up and they help with depression. Then they're not habit forming and don't cause problems with your brain. Well, I wanted to bring this to awareness. Antidepressants are a crutch. They do not change your life. It just changes your brain for a short term time, and we need to make a change. And, well, this can do damage to your brain long term, and I've seen it many, many times. So just want to give you a heads up about that. If you have something going on, give me a call at 831-869-9119. I have a lady with diabetes, and she has flutters of her heart and all kinds of things. And we're going to turn that around and get her extremely healthy. And we can do it. 831-869-9119. Also, remember God, remember I love you, and remember that we come from the ocean of consciousness. And sometimes when a wave from the ocean hits the rocks and a little bit of water or droplet goes way up into the sky, and that's our life right there, going up and coming down. And we feel separated from that, which is love and all the feelings of being connected to everything. And then we come back and join that amazing ocean. We will connect again. Allow yourself to know that everything in life, we keep looking for all this pleasure all the time, but we get more pleasure, and eventually we find pain in every single pleasure. It's not to be found. That true joy is not to be found here. It's inside of us and connected to God. I love you.